Hello, myself Dr. Manajeet Patil, consultant plastic and cosmetic surgeon. Today I'll be discussing about a nose job. It is called as a rhinoplasty. So what exactly is a rhinoplasty? Rhinoplasty is a surgical procedure done to improve or enhance the beauty of your nose in along with the achieving the facial symmetry. We can change the tip of your nose, we can alter the width of your nose, we can reduce the bump on the nose. If there is a depression, that can be corrected. If the nostrils are pretty wide, that can be shortened. If your nasal bridge is wide, that can be shortened. And if you need any enhancement, say augmentation on your nose, that can be done. These are the common corrections which we do in a rhinoplasty surgery. The patient should have completed his facial growth. What I mean by that is, in case of boys, they should have at least attained 18 to 19 years of age. In case of girls, they should have completed at least 17 years of age. Those someone who have completed their facial growth, for them we offer a rhinoplasty. So you have to discuss with your plastic surgeon about what is bothering you exactly, whether it is bothering about your lower portion of the nose or the upper portion of the nose, or you're unhappy with your width or the length. All those things you have to discuss. Based on that, we can offer what can be done. We'll be offering you one or two options, out of which we'll also recommend you the best one. Based on that, we can go ahead with the surgery. The common risk are risk of anesthesia. There will be a small scar. There will be a temporary swelling which will subside. You can expect certain bruising, swelling. Most of it will subside over a period of time. So once if you have decided to get the rhinoplasty done, you have to have a consultation with anesthesiologist, get a pre-anesthetic checkup, get a few lab tests done. Certain photographs will be taken before the surgery and compare it with the post-op. So see the final outcome. There will be something called a scarless surgery also, which we call it as a closed rhinoplasty. So wherein most of the cuts will be inside your nostril, wherein no scar will be visible from the outside. And the other method is the open method, wherein apart from the inside cut, there will be a small cut over your nostrils also, which will be barely visible only when you lift your head. So this is the different approaches, but the final correction after the cut, which remains the same. For example, if someone has a deviated nose, that is corrected in the surgery for a better air intake and also for the proper inhalation. And in case of, suppose if someone has got a wider nasal bridge, we do something called a osteotomy and reduce the width of the nasal pyramid. And if you have a wider nostril, we may excise a bit of soft tissue to trim it down and reduce the width of your nostrils. Suppose if you have a up tilted nose, that can be dropped down. If you have a drooping nose, that can be lifted up. If you have a bulbous nasal tip, we'll trim out a little bit of fibrofatty tissue to make the tip look little sharp and good. These are the certain changes you can expect post surgery. There will be certain bandages and tapes on it, and that's it. Once the surgery is done, like many of this cosmetic surgery, there will be some swelling, some pain, some bruising. Most of it will settle. You will see certain plasters or tapes or splint on your nose, most of which will remove after a period of a week, and you can go back to your work after a week, and you can start most of your work after 2 weeks or so. So recovery will be excellent.